So steroid injections, people ask, should we do them, should we not do them? It's really on a case-by-case basis. I like to assess my patients 3 weeks after surgery to see how their swelling is going. The typical area that I like to inject is going to be this area. So we're here with our beautiful patient. She's just 3 weeks, and actually the shape of her nose is coming down very nicely. You see the overall shape. And again, it's only 3 weeks, but there's a lot of like kind of softness all around these areas. So I like to give a little bit of steroid here into the supra tip. So here's your tip. This is the above the tip area. And sometimes I'll even do a little bit on the sides over here. I use a very, very dilute, meaning a low strength Kenalog, because if you put something too high, you're going to end up with little divots, and we really don't want that. And we're also putting in a very small amount. So what is it going to do? It's just going to help that swelling, especially in those areas, go down a little bit faster. It's not a miracle, but it does help it go down faster. Why it's important is sometimes areas like this, especially if you're not taping or doing anything like that, it can accumulate that swelling, and that swelling then turns into almost like a long-term swelling. So if we stay on top of it, then we can prevent that, and you can get that shape that you're really looking for a lot sooner. All right, so the steroid shot is a quick little pinch over here, and it's just like that. There you go. It looks and sounds more painful than what really it is. Now, the nose at this stage is tender and sensitive, but at the same time, and this is what I hear from every patient, tender and sensitive, but the skin is still kind of numb. Would you agree? That it's numb yet tender? So it's kind of a weird thing. And this is why these shots, they feel like, what would you describe? Like little pinches?
Yeah, little pinch.
But not as bad as like you would think of a needle going into your nose.
No.
Yeah.